All right, good afternoon, everyone, and welcome to part one. I guess it's not really a two-part series, but it is still navigating needs, and we are going to be able to hear from Dr. Brooke Harmon this afternoon. So I'm going to take a quick second to read you her bio, and then we will not waste any time and let her jump right in. Dr. Harmon is an associate professor in nutrition and foods at Appalachian State University. She holds a BS in human nutrition, MS in exercise science, PhD in health promotion, education, and behavior, and completed a postdoctoral fellowship in cancer epidemiology. She is also a registered dietitian and holds a certificate in gerontology. Before earning her doctorate, she served as the director of dietary interventions at the Cancer Prevention and Control Program at the University of South Carolina. Dr. Harmon uses community-based participatory research approaches to partner with faith-based organizations in the development and implementation of health promotion and disease prevention programs. Much of her work includes partnering with churches to promote health through culinary and physical activity skills training, as well as research on leadership and environmental factors that influence health-related behaviors. So thank you, Dr. Harmon. We're just so thrilled to have you with us this afternoon.
Thank you, Stephanie, and thank you all for joining us. I'm really excited to be talking to you guys today about conducting needs assessments and really thinking about how we can use congregational needs assessments to help us serve older adults in congregations and communities. So I'm going to start by just giving you a little bit of an overview of what we'll do. I'm going to give you a little bit more of a background on me so you can kind of see kind of where I come from and how I got into this space of doing congregational needs assessments. Then we'll talk about the what and why of congregational needs assessments. I'll show you some needs assessment tools and break down kind of why we've collected data in different ways. Talk about how you engage congregations, use the findings, and then we'll have plenty of time at the end for you guys to ask questions. So getting started and introducing myself. So Stephanie gave you my educational background, and you can see that it's mostly in the health sciences. So started off in nutrition and exercise science, got my PhD in public health, and really because I've always been interested in prevention and how can we help individuals and communities prevent particularly chronic diseases. And so throughout my educational background and then also my work, I've been trained in engaging with communities. So how do we work with communities to really not kind of impose our ideas on them, but really help them tell, us and kind of research and healthcare what the needs are and where we need to be going. And this work was really done within the lens of health disparities work. So I was for 6 years worked as the director of dietary interventions at the Cancer Prevention and Control Program in South Carolina. And a lot of what we did was work with congregations to address health disparities. And so that's where a lot of my work came from. And then informed my dissertation. And I was laughing with Stephanie and Christy at the start. I said, I think I'm the only person who that I know that still uses their undergrad degree at this point and is still doing work that relates to my dissertation. But my dissertation was focused on health promotion programs in congregations, environments of congregations that support health, and then also looking at clergy health. And then I just was able to expand on that and really understanding needs and needs assessment with my postdoctoral fellowship. So the University of Hawaii's Cancer Center has this large multi-ethnic cohort study that they do. And so that really helped me kind of understand how do we think about different communities and diverse communities and understand needs and then use that information to really do practical programs and strategies that address those needs. The congregational needs assessments that I'll talk about today are the Mid-South Congregational Health Survey, which was work that I did when I was at the University of Memphis. I'm currently at Appalachian State University, which is in Appalachia region of North Carolina. I've been here for 4 years, but previous to that, for 6 years, I was at the University of Memphis. And so that's where we started the Mid-South Congregational Health Survey. I'll give you some background on that in a little bit. And then we transitioned that work to what we call the High Country Congregational Health Survey here in Appalachia and then the kind of western corner of North Carolina. So today, I know you guys are coming from across Tennessee, so you'll get an introduction to kind of this methodology in kind of an urban setting and then also a rural setting. And I'll talk about how some of our strategies and our tools differed for those two settings. And hopefully that'll help you guys with some practical tools and some ideas for how this may work in your communities. So to talk about congregational needs assessment, so we'll talk about what they are and why we use them, just to kind of ground us at the beginning. So whenever we're thinking about needs and we're thinking about congregations, we have programs, we have services, we have things that we're doing as congregations to support and help our members and the communities that we serve. But there's always kind of an underlying level of needs, and our services may not fully cover those needs. So there may be a gap in the programs we're offering and then the needs that our congregations are facing. And so needs assessments basically are just a systematic way of evaluating the health status of your congregation, determining what needs are present, and then deciding whether or not your current programs, ministries, outreach efforts are addressing those needs, or whether we need to be doing additional things, efforts, strategies, etc. So that's all a needs assessment is it's a systematic way of looking at health needs and programs that we are offering. The reasons why we do congregational needs assessments are varied, and it's going to vary for every congregation and community. So for some, it may be that there's a need for new or updated information. So we're kind of in this post-COVID era where congregations are trying to figure out kind of what we are and how we serve. You may have a new pastor or new leadership, and they want this information to better understand the congregation. You may have programs that you feel like maybe have been there for a while and maybe don't have the same participation. Maybe they just don't feel as fresh as you would like them. You're kind of like, we want to do something new. We're going to try something different, but we're really not sure how to do that or what direction we should go. You may have changes in the demographics of your congregation, and so you may need to develop new ministries to address new people and new needs. And then we know congregations are helping the spiritual health and well-being of our communities, but congregation members also come to, find churches and congregations and organizations that can help them in tangible ways too. So maybe they're wanting social support and a place to come where they feel like they belong. Maybe they're wanting to get more involved in community outreach efforts. Maybe they love the youth group and the things that the youth group is doing. So they're tangible things that congregation members are looking for, and needs assessments can help us better understand that. You may also be working with multiple congregations. So pastors may be, pastoring at multiple churches. You may be in a leadership position in your denomination or in your kind of geographical area. And oftentimes we find that congregations have the same needs, but they're having to all do their own programming, where we could potentially do some programming at a higher level that coordinates those efforts or provides some support and doesn't put the burden of programming on every single congregation. And I'll talk about some of the ways that we've done that in some later slides. And then the last thing is churches are, can be recipients of grant funding. And so when you are going for those types of foundation or other types of grants, having data on your congregation and their needs can really strengthen those applications. And so being able to have this data to then really understand where should we go for funding and then have a strong application is another reason why some congregations do needs assessments. So one of the things that I do here at Appalachian State is I teach a community nutrition class. And as part of that class, I teach them how to do community needs assessments. And so this set of steps comes from the textbook that we use. I don't necessarily love like the steps, and then the work that we do doesn't always fall neatly into these steps, but I do like it as kind of just an overview and an outline of what a needs assessment is. I think it does break it down into kind of nice chunks that we'll talk about today. But the first part of it is really setting your parameters. So, we're talking about congregational needs assessments, but we also are interested in older adults. So your needs assessment may be specific to older adults. It may not be the entire congregation, and that's okay. It may be the congregation and the community that surrounds the congregation. So what is the parameters? Who are you interested in reaching? Whose needs are you interested in addressing? So that's step one. Step two is developing your data collection plan. So how are you going to collect the data? What are you going to ask? Who are you going to reach out to? And then three is actually collecting the data. And we'll talk about this in the upcoming slides, but who are the individuals that are representing your congregation? So you want to get some demographic information about the individuals who participate in your needs assessment and complete the surveys. You want to make sure you're asking questions and collecting data about the kind of larger context within the congregation. So what programs are already there, what initiatives are already going on. And then you want to also get some information about the congregation. So things like denomination, things like geographical location, church size, things like that. And I'll give you some examples of ways to ask those questions here in a little bit. And then you analyze, once you've collected all your data, you analyze and you interpret that, and then you share the findings. And one of the things that the textbook that I pulled this from does, and one of the things that we talked about and use in our needs assessments is really making sure that this is a collaborative process, this kind of sharing findings, setting priorities, choosing a plan of action. So when we work with congregations, we usually suggest that whoever it is that's going to do kind of spearhead this initiative and lead it, whether that's a ministry leader or some other church leader or just a member in the congregation, that they also have a group of people that they're working with. So whether that's the pastor, whether that's other leaders, whether that's a group of congregation members. And so that it's really a collaborative process of taking the findings from the survey, using that to set priorities, and then using that to kind of lead them towards a plan of action. And I'll talk about, even though you may find kind of a top need, that may not be the need that you ultimately kind of focus on, because you may have other things that you're doing and you're like, well, we're addressing that need in these ways, but this need here, we have nothing focused on it. So we're gonna do some programming around that. So the step 5, 6, and 7 is really an iterative process and really is best done if you have a variety of people who are kind of looking at the data and helping to come up with decisions and priorities. So I'm going to talk now about some specifics. So I'm going to go into some assessment tool examples. So I'm going to start with the Mid-South Congregational Health Survey, and then I'm going to talk about how we adapted it for the High Country and show you some of the things that changed and talk through kind of how you would adapt a needs assessment tool depending on your location and just your the groups that you're working with. So with the Mid-South Congregational Health Survey, so this was developed, we started this work in 2018. It was a community healthcare academic partnership. So we had people from all kind of aspects of community, some healthcare organizations, and then several academic partners who really worked together to create this needs assessment tool. And I'll show you some parts of it. And then also the methodology that we used to collect our needs assessment data. So a big partner at the healthcare level was Methodist Lebanon Healthcare, and they have an outreach network called the Congregational Health Network, which is, I think it's about 300 churches that they work with to kind of do varying types of health promotion efforts. In Memphis is also something called the Church Health. So Church Health is a clinic and also does outreach. And they had an outreach program called the Congregational Health Promoter Program that we worked with. Because where Memphis is, and some of Church Health and Methodist churches, they actually fall into kind of northern Mississippi. We also, part of this partnership was the National Faith-Based Mobilization Network. There you go. Which is Pastor Minor and his wife Lottie Minor organized this, and they're in northern Mississippi. And so we wanted to make sure they were part of the conversation because they have a lot of experience in working with congregations in Mississippi and trying to do similar types of efforts. Then the academic side of it was myself and a colleague at the University of Memphis, and then one of our colleagues at Johns Hopkins. And I also part of Faith Monette was Miss Bettina Campbell, and she actually had been doing some of this work in Michigan with congregations and with organizations there. So she was another community partner who was working with us as well. So we all got together and kind of started creating an assessment survey, some methods. We then took it out to congregations and had them look at it, and I say nicely, rip it apart, which is how things should be done. You kind of ideally come up with a tool, and then you take it out and you try to pilot it in the real world, and things got to change. And so we did that process. We came up with a new and kind of revised way of doing things. And then started to roll it out. I think it was early 2019. So we had about a year and a half in which we rolled it out pre-COVID and collected needs assessment information. So I'm going to talk to you a little bit about the ultimate tool that we came up with, and then show you some of the ways in which we shared findings as well. So I mentioned, some of what we do and some of what we collect with needs assessments is individual information. And so for us, we wanted to get demographic information about the individuals who are completing the survey. So your typical age, sex, race, marital status, education level, but also their role in the church. And I'll talk about why that was important here in a second. And then length of time attending the church. The other thing that congregations were interested in collecting was really understanding why people attend the congregation. So what is it that they are coming for? What aspects of spiritual health are they looking at? What aspects of maybe the service? What aspects of other outreach ministries that the congregation has? And then where are they finding their supports? Because we wanted that kind of context to help us really ground the information that we were collecting. We also collected information about the congregation, so denomination, zip code, whether or not congregations are interested in grant funding, whether they had any experience, because that would also help us to kind of look broadly at needs and then help group people who may be interested in going for grant funding and who have similar needs together, and maybe they could do grant applications together. We were also interested in just kind of the health context within the congregation. So is the pastor talking about health? Do they already have programs and strategies and initiatives that are going on in the church? And this was really important for the congregations too, because they were really interested in, if the pastor thinks that they're doing well and showing the congregation that they're interested in health, but the congregation doesn't see that, the pastor wanted to know that. And we also wanted to know, and the congregations wanted to know, do the congregation members know about all of the programs that we are doing? And so that's why we asked these two questions to get some more context about the congregation. Then we moved into the actual needs. And so we did this as an index. So we just had a listing and people could check all that applied. We grouped kind of physical and mental health together. We didn't want this to be an exhaustive, we didn't want it to be kind of 40 pages of a survey. So we had to be really thoughtful about, using some of the kind of data from national as well as local and state public health departments and kind of what we knew were kind of prevalent conditions, but then also using expertise from the community and the congregations about how we should phrase things and what should go on the list. So this was kind of the mental, physical health. We also wanted to ask about social health, so public health terms, social determinants of health, but really trying to get a sense of, a lot of congregations are focused on their members, but they're also focused on a larger community and what may be happening outside of the church walls that may be influencing members and influencing that larger congregation, and what needs were perceived there as well. So this was kind of an exhaustive list. People could check as many needs as they wanted, but then we asked people to narrow it down. So tell us what the top need is that you want your congregation to address with future programming. And so we have all those needs, and they check one, and then tell us what the barriers are to addressing that need, because that's things that your collaborative group is going to have to look at to determine, all right, can we address this need given these barriers? Are there things that we need to do first to overcome barriers before we can address the need? And I'll talk about that in a little bit and show you a scenario for that. But this was the top need. And then, so this was kind of the information that we could use and share back with congregations about, like, this is where, all of these are needs, but these are the priorities. As we moved this to where I am now in Boone, North Carolina, I met with some community representatives. So I had started here in the fall of 2020, got to meet representatives from At Faith Health, which is basically the same as the Congregational Health Network. So it's based on the same model that started at Methodist LeBonner Healthcare. And then I had a community nutrition class actually that started in the spring. And so that class worked with representatives from At Faith Health and 5 congregations to adapt the Mid-South Congregational Health Survey to the High Country Congregational Health Survey. And most of it was refining some demographic language and formatting. But if we think about it, Memphis is an urban setting. Primarily the congregations that the Congregational Health Network works with are African American. Some of them are small churches, but a lot of them are medium or large churches. And then here in Appalachia and Watauga County, we are pretty rural. We are also primarily small congregations and primarily white. So we knew that there were going to be some different needs that we would either have to add or change or revise. And so that's where the bulk of the survey kind of changes and adaptations happened when we moved the same needs assessment tool to the High Country. So a lot of the same demographics, a lot of the same congregation related questions. We refined some of the language, but I'm going to show you how we changed and added needs. So one of the things that the congregations here talked about is their congregations were primarily older adults. And so these were some of the needs that got added because of their population being older. So caregiving, transition in care, affordable medications, programs for seniors. coping with loneliness, isolation, connectedness was also part of that. But some of this is also because we started this work in 2021. And some of what COVID did is really raise our attention to loneliness and the impact of loneliness on health. And having, congregations that were older, this became a concern for the congregations and a need they wanted to add. Because we are a rural area, how we kind of discard trash and waste facilities and that reaching out into some really rural areas was a need that we wanted to add. In addition, we also have to think about how, just society is evolving. And one of the things that we wanted to add was creation care or environmental awareness. And so this actually, if we think about doing needs assessments, and if you guys are doing needs assessment with your congregations and you decide to do one, say this year, and then you want to follow up in say 3 to 5 years and see if the needs are staying the same, I'm always a big fan of keeping your survey the same because that way you can track trends over time. But one of the things you do have to think about is, are certain issues becoming more of a concern for your community, for society, for your congregation, and do you need to add those to the survey? And so that was one of the conversations that we had. And so this idea of environmental awareness was added to the High Country Congregational Health Survey. So that's the tool.
Dr. Harmon?
Yes.
I was going to ask you a quick question that came up in the chat. Can you address literacy? Did you have issues with anyone who could or couldn't read, or language disparities?
We did not. So one of the things that we did do is have congregations who were going to be the ones that were going to implement this first. We did have them review it. We had them pilot it with some members in their congregations to make sure that congregations kind of understood the language and that sort of thing. I will say a lot of these kind of slashes are because people were like, well, I don't understand what creation care is. Well, we call it environmental awareness. I call it coping with loneliness, but this person calls it isolation. So we did have some of that conversation. And so that's why we do have some of these slashes, is to try to give some of that language. Now, we've only ever worked with to date English speaking congregations. We do have a congregation here in the High Country that is primarily Latino. And so there have been some conversations about getting it translated to Spanish. And that's a conversation that is still ongoing with the network here. And then we haven't had issues with literacy per se. I'll talk to you a little bit about kind of methods for implementing the survey. And we do it both a paper-based and an online version. And I'm not 100% sure. Nobody has told me specifically, but I can't rule out that some people have sat with a congregation member and read it to them, and that's one of the reasons why they wanted paper versions. So we've tried to give two modalities so that people could access it at home if that's easier, or they have this option of doing it paper. And we have had some congregations who've kind of done it together, had everybody kind of come in, and they've done the survey kind of in the fellowship hall so that the person could kind of explain it to them. And in those settings, they may have also been reading it to the member as well. Does that answer the question fully enough? Perfect. All right. Very good. So let's talk a little bit about engaging your congregation and kind of the numbers of people and who you should ask to be part of your needs assessment process. So there's always a big discussion about leaders versus members. So some people who do needs assessment work with congregations and other communities look at just leaders. So they recruit leaders. They may just recruit the pastor. They may recruit a pastor and a couple of other leaders. We have taken the strategy of asking that at least one leader do the congregational needs assessment, but then the rest of the needs assessment be primarily members. And those members could have varying levels of leadership. So, coming from, say, the Presbyterian denomination, elders could be part of that, but, they're also a member. If there's a structure in which there are associate pastors and youth pastors and things like that, you could have like senior pastor and an associate pastor do it, and then other members, and denominations and church structures where there are ministries, ministry leaders may be part of it, but then also having senior pastor and then also having members. So depends on the size of the congregation, depends on kind of the structure, but we are big believers in having a mix, and I'll show you some data why. So this comes from some of the data that we've collected with the High Country Congregational Health Survey. A student of mine looked at kind of leader versus member perspectives, and what you can see from the bar graph and then also the table is that for the most part things are similar. So we see the top three are the same: anxiety, so kind of mental health, this idea of loneliness, and then homelessness or affordable housing. But there is a bit of a kind of shift in kind of priority when you look at the kind of green leaders and then the light green members. We also saw a slight difference in barriers. So top 5 is pretty much the same, slightly different orders, but we did see that among leaders, one of their this is not related to barriers, it's actually related to needs. They actually put a need of childcare down, and then members actually put a need of programs for seniors down. So we, outside of the top 3, we did start to see this kind of little bit of shift in needs. And then we also, I was going to make sure I got the barriers correct as well. Yeah, we also saw caregiving come up as a need among members that wasn't necessarily a need that we saw among leaders. And then barriers, you see that, for the most part, things are very similar. But one of the things that came up among leaders that didn't come up for members was this idea of funding. And so one of the things that we do find, and I found this in other studies that I've done, so I did a study with Latino churches. It wasn't a full needs assessment, but we did interviews with leaders and members to try to understand kind of where they would want to go with health promotion programming. And we saw that leaders really understood kind of resources out in the community that members maybe weren't aware of, but yet members had ideas about needs within their congregations that leaders maybe didn't know about. So based on that information, and then based on some of these differences that we do see, we found it to be important to have a mix of leaders and members complete the needs assessments. So how many people should you recruit to be part of the survey to complete it? We've been working primarily with networks who have staff who then work with congregation representatives to then recruit congregation members. And the networks that we're working with, these staff have other priorities as well. So doing a needs assessment is just one thing that they're doing in the list of all the other things that they're doing. Same thing with you all and congregations and your roles in congregations and the work you're doing there. Most of that is volunteer. And even if it's a paid position in a church, you still have multiple things they're doing. Needs assessments is not just the one thing you're doing. So we have always opted for less people, but being very purposeful in who those people are. So we haven't really said, yeah, you need to have your entire congregation complete the needs assessment. We have gone with 1% of the congregation, no less than 5, no more than 30 people. And then what we ask is that people are very intentional in who they ask, so that the demographics of the people that complete the needs assessment match fairly well with the congregation overall. And we've done a pretty good job of that. We've had a couple of churches where we maybe have had to go back and ask a few more people because they were like, well, that doesn't exactly match. Or I just was asking people who were easy to reach, or people who kind of typically do all of our surveys, or, you know, do all of the things that we ask of them in the congregation. And we don't necessarily want to do that with the needs assessments. You know, we want to, you can definitely ask an entire congregation. You can definitely ask an entire subset of the congregation if you have the ability to do that. We just have been always mindful of, this isn't the only thing that people are doing, and this can be a lot of logistics and a lot of trying to track people down, get them to do the survey, get them to do it completely. Then you've got to process all the data. And so we've always gone with a smaller number, but being very intentional about who the people are that are recruited and asked to do the survey. And then I mentioned this before, you know, we give the option of paper and online to, again, make it a little bit easier for people to complete the process and to just provide the options that work best for the congregation. You know, your congregation, one way or the other, may work best for you. And so just, you know, having both options, have one or the other, but these are kind of the ways that we've gone about it. And then I just want to show you some of the data and talk about how you could use the findings, both within your congregation and then if you're working kind of across congregations as well. So we analyze the data, and basically we do a lot of frequencies and bar graphs, so it's not complicated stuff, but we just want to share with each congregation who participated, what they perceive as the resources that are available for health in the congregation, what needs they identified, what the ranking was, so what came out as a top need, and then what barriers they see to achieving or kind of addressing that top need. So these are kind of summaries across churches, but this is basically what a congregational report would look like. So we would provide them based on all of the assessments that were done, that index that I showed you guys, who checked what boxes, this is what comes out as top. So we, if it's all mind, body, and soul, it would be all mind, body, and soul. But we also do try to look at, is there one or two resources, neighborhood issues that also come out that we can also share? Because we really want to think about health holistically and help congregations do the same. So this is kind of what that overall kind of index of needs report would look like. And then we also then look at that top needs and let them know, okay, well, across the people who completed this, the top one, 21% picked loneliness, 21% also picked mental health, and then a lower percentage picked, affordable housing. And then this is the barriers that they assign to those needs. And so this is helpful to kind of look across these to see, are these things that we need to address first? So you can see from across the needs, we see light blue bars, particularly for mental health and loneliness. So this need for training. Purple is coming up as well, so need help from outside the church. And then with affordable housing, kind of lack of funds. And so one of the things that we talk with congregations about is, okay, what can we do as an academic setting? What can we do as a healthcare setting? What can the network do to help address these barriers first, and then allow you to develop programming around the needs? And just some of the programs that people have that have come out of these needs assessments. So we've had some congregations where I'll tell you this to start off with, for both Memphis and the High Country, loneliness, isolation, and mental health have been the top two needs. So when we look a lot across congregations, those come out as the top needs. So as far as addressing kind of that loneliness, isolation, we've had a church that's kind of developed this kind of games and lunch that they do. I think it's either monthly or bi-monthly. Other churches have developed support groups. So for people who are kind of feeling isolated because maybe they have a loved one who has a long-term illness, or they're feeling isolated because they've had a loved one who's recently passed. for mental health, we've had churches who've engaged around mental health first aid training. At Memphis, the Methodist healthcare system already had a mindfulness-based stress reduction that's offered to associates and patients of the system. And so we were looking at and working on kind of modifying that a little bit to bring an introduction to mindfulness-based stress reduction to congregations, because it's a way of thinking about pain management is where it's often used, but then also chronic disease management. A lot of chronic disease management are kind of incorporating this into their work as well. At a network level, we have seen networks starting conversation groups. So for clergy, there's an initiative now at the hospital where if they're coming to visit a patient, there's also where the At Faith Health Network folks will buy them a coffee and have conversation. And so, and it's, the clergy who are all there at the same time. It just gives them an opportunity to talk to other clergy, to decompress with network staff, that sort of stuff, to kind of help with loneliness that we're seeing at the clergy level. And then the last one, guest speakers. So the network is also bringing in some kind of experts in the field around how do we help individuals cope with loneliness and isolation, particularly coming at it from a faith-based perspective, and bringing in kind of nationally recognized speakers to talk to all of the congregations. And so I'll stop there. I want to share, my phone number, my email address, in case you guys want to reach out after this and have specific questions. I think it was shared in the promotional information, but I'll also share it here too, because if you go to my faculty page at App State, I have links to some of the Mid-South Congregational Health Survey materials. So that's there if anybody wants to follow up on those, but I'm also happy to send copies of this to anybody who would like it. So I'll stop there and just see what questions there are in the chat, or if folks want to ask questions.
Thanks, Dr. Harmon. There is a question, a comment and a question from Anne. Sounds like purposeful sampling and aggregate frequencies were calculated. What data management software do you suggest?
Yeah, so we collected our data using Qualtrics, just because the universities have had that license. So you could definitely do it with SurveyMonkey or something like that. When it came to like actually analyzing the data, we used SPSS, but you could definitely do this in like an Excel program, because all we were doing were calculating frequencies and then looking across those frequencies for kind of top frequencies and then putting that into bar charts. So you could easily do this in an Excel spreadsheet and be able to produce the same type of stuff.
And so for those who aren't as familiar with statistics, frequencies is the amount of times an answer occurred.
Yes. Yeah, exactly. And basically what we did is, Qualtrics, and SurveyMonkey does the same thing. And any paper surveys we had, we just entered into Qualtrics. So we would have it all come out in a data set, and Qualtrics and SurveyMonkey both will just download it into an Excel spreadsheet. And like each person's survey will just be a line, and we would just go to, okay, what is the age? And then calculate the average age. How many people were marked that they were a member? How many people marked that they were a leader? Okay, this need of mental health, like how many times was that marked a need? And so that's another reason why having a smaller subset, but being purposeful about who that subset is, makes the data analysis a little easier, because we oftentimes for the church reports, we're just looking at the lines and counting up the numbers. And so if you've got a ton of people, that's really hard to do. But, my student would do it. I would review it to make sure it was accurate. And then we would then just put that data into bar charts and pie charts and things like that to make it graphically easier to understand. But I mean, we were doing low skill counting, now when we look across congregations, that's when we'll put it into SPSS and do a little bit more aggregating and looking at the data. But for church reports, it's pretty low tech.
That's been my experience as well. As we've done some of our work. It's old school counting and input, and not necessarily using more sophisticated programs. So I know I've used Google and Microsoft to collect your data, or Microsoft Forms. Have you used any of those programs as well?
We have not. With Memphis, a lot of the churches wanted paper forms. And so, we were started out fairly old school there. They actually used SurveyMonkey. And then we just have kind of kept the same thing because I have access to Qualtrics here. We've done that. And then if they feel like either congregations don't have access to the internet or computers, or would prefer a paper survey, we've just done that. So we haven't done Google Forms. But that's definitely an option.
Sure. So switching gears a little bit, did you have any kickback from churches? And if so, how did you overcome it?
Not really. I think one of the things that we talked about a lot as a group when we started this was, would churches be open to talking about mental health? If we put mental health needs on there, how would that come across? And so we did have some conversations about that. I think churches, and the feedback that we got was that they were open and they were interested. One of our folks from the community is the one that came up with the mind, body, soul labeling. So it felt more in line with kind of faith-based organizations and their values, and less like healthy and public healthy kind of, and like data collection-y. The other thing that we've struggled with is just engaging congregations. So we have congregations that are like, yes, we're interested, we want to do this. We have congregations that are just like, this is a lot for me to take on given all the other things I'm doing. And then I think within congregations, there's again that same, we've identified our people, we have people who are eager, they do it. And then we have people that's been really hard to get them to engage. Should I find somebody else? Those types of conversations. And, we've kind of just worked with congregations on where they're at. I tell the network here all the time, like, this is data for congregations. And if it's not helpful for them at this time, that's perfectly fine. If they can get 3 people to do the survey and they think that would help them, we'll analyze the data and give them the report. So I think we just have to meet congregations where they're at. That has been probably the biggest thing. I've not had a congregation or a congregation member say, this is a horrible thing, I don't want to do it. Why are you asking these questions? There's either been, we're interested, we feel like will help us, or we're interested, but we don't have the time right now, or we have to have those conversations about why would you do this?
Mm-hmm.
But once we have those conversations, people have been really, really receptive.
And I think that's been my experience as well. Every congregation, just like individuals, are at different places in their journey. So, the church might be 100 years old, or it might be a church plant that's 6 months old. And so they all have a different level of need and a different level of capacity to address that need. So I have found that having a conversation first with whoever the contact person is, and then potentially having them pull in a couple extra people just to have the conversation of, where you're at, what you're really looking for, what your true need is, the reason you contacted us, or the reason you came to an event, and then kind of starting there. And eventually it kind of leads to a more formal needs assessment. But it's kind of like, we always say people can't treat their blood pressure if they're hungry. They need food first. So it's that concept that we want to address the reason that they attended or came, and then we can kind of work through some of the bigger issues or barriers as we go. Dr. Harmon, I know that you have a toolkit of sorts. One of the questions was about, if you have materials to help others conduct surveys or use some of the language and wording.
Yeah, definitely. And so if you follow the link, and I told Christy give you and Stephanie, the PDF of these slides. And so then that way you can have that and share with folks. And so if you navigate to my faculty page, all of those pieces that are the toolkit are on there. And so they're the Mid-South Congregational Health ones. We don't have the High Country ones on there just because of space. But if folks are interested in that version, just feel free to reach out to me. I'm more than happy to share that one as well. And it may end up getting up there, just haven't gotten to that point yet.
Thank you so much for all of you participating and for your comments and questions in the chat. You're also welcome to unmute and ask questions if you like of Dr. Harmon while we have her.
I had a question about whether you ever survey where people currently are getting some of these needs met outside of the congregation, because it occurs to me that some community or some people in the congregation are very happy with their lodge membership or their pickleball group or whatever, that really are the community that the church sometimes assumes or wishes that it was for members.
Yeah, no, we haven't asked that. And that's a really good, a good question that could be added. I think and we ran into this when we were asking about kind of resources that are available in the church already, is like, how do you ask that in a way that helps you get, it's hard to ask open-ended questions because then you're going to get all sorts of stuff that you have to sort through, and then trying to kind of create a list. But you can definitely create a list that's like, are you getting, are you engaged in social clubs and this and that you could gather that information and add to kind of a better understanding of needs that they are getting met elsewhere. We tried to, and we played around with the language, and it has changed from how we asked it in Memphis and then how we ask it here with kind of needs related to the congregation. So we've tried to focus it on like, these are needs within your congregation. These are needs that you want your congregation to focus programming on. And that has been, that is still one of the things that people still like kind of have to have clarification on. And one of the things that happened with Memphis is congregations wanted us to ask it in a way that was about the congregation and the community they served. And so that sometimes got a little confusing for folks. So you just have to think about too, like how you phrase that question. That may also kind of either define your parameter to like just the congregation, or also kind of the larger context of members' lives and the larger community. And I'll just answer, since Christina, you're still on, you asked a question about point of contact handling the survey. Typically it was a health ministry leader. So it varied from church to church. Sometimes in our smaller congregations that don't have like formal ministries, it was just the person who worked closely with either the Congregational Health Network or At Faith Network. So it was somebody who was already kind of part of this health congregation kind of collaborative, who was then the point person.
Okay.
Yeah, and it wasn't always the pastor. So sometimes it was someone outside of kind of the senior leadership. So
that is exactly why I asked the question, because I've worked with congregations before where exactly like you said, oh my gosh, can I add one more thing? I don't have the capacity. And so where I've had success in doing similar things, it's been when I've said, hey, I'll do it.
Mm-hmm. Yeah.
With your blessing. Let me be your extension.
Yeah. And that's often what would happen is, the pastor may be the one that says, yes, like we want the congregation to do this, but then someone else really does the kind of nuts and bolts of kind of figuring out like who to ask, actually getting the surveys to them, getting the surveys back, looking at the data. Well, we helped them look at the data, but yeah, it was typically not the pastor, but somebody who was kind of interested or engaged in this idea of like, what are our needs? What are our health needs in the congregation?
Thank you very much. This was great.
Oh, yeah, no problem.
Thanks for coming.
All right.
Thank you. We will see you tomorrow.
See you tomorrow. Bye, everyone.
Bye-bye.
Thank you, guys.